Tommy has returned home and things seem to go well for the first few days. Everyone is happy at first and makes a fuss over Tommy. Then the family settles back into their regular routines except for Tommy. He is still having a lot of difficulty walking and feels awkward on crutches. He continues to require physical therapy. At therapy, sometimes he's cranky and other times withdrawn, not wanting to interact very much with the other children. Over the next several days, Tommy complains of feeling sick and not wanting to eat. He refuses to go to school and doesn't want to go anywhere. His friends want to visit, but Tommy doesn't want them to come over. He doesn't want anyone staring at him. Tommy's parents are concerned.
Returning home can be both a happy and a challenging time. Many families imagine they will just pick up where they left off and don't anticipate the adjustment they need to make. Parents can feel unskilled in caring for their children medically. Children often miss the special attention they received in the hospital and may get more easily frustrated or resentful. Friends and extended family may go back to their own activities thinking that the crisis is over. Children and teens may have a hard time, especially if they cannot return to normal activities. They may want to do things on their own but not feel ready and may withdraw or act out in response. They may not want to see friends, worrying what others may think or questions that they may ask. Or they may not want to venture too far from home because they will have to face reminders of the trauma. Even returning to school can be difficult if children feel singled out or unable to blend in because they cannot participate in sports or other group activities. Healthcare providers can help families anticipate the challenges of returning home. Ask parents about what they need to care for their child at home. Help them understand that all family members need time to readjust and help them identify the coping strategies they can use. Encourage children to do things on their own as appropriate, but do not invalidate the temporary losses and frustrations they may experience due to their physical changes or their inability to resume their usual activities. Help families understand that getting back to reality is difficult and can be fraught with new triggers, new feelings, and new firsts. Help kids plan what to say to friends and family and support them in reconnecting with friends. Also remember that avoidance is one of the most common traumatic stress reactions. Not only can children and families avoid situations that remind them of the trauma, they can also avoid other reminders, like the hospital. Avoidance occurs because children and parents fear that they will not be able to cope with the reminders. You can support a stepped approach to help families confront the upsetting feelings or reminders that the trauma might bring up. Encourage them to talk about their feelings with a medical or mental health professional if their distress or avoidant behavior continues or gets worse.